So I was at dinner the other day. Oh, let me get the light. There we go. And I was chatting to this architect who was kind of, with a bit of arrogance, said like, "Oh, I don't need to worry about my longevity." And I was like, "Oh, really? Why?" He's like, "Well, I know I'm healthy because I did a Wellman check." I was kind of like, "Okay, interesting, right? Here we go." So tell me a little bit more about it. And he started saying like what he did. And the more I probed, the kind of more he wasn't particularly comfortable that he knew exactly what he was doing, what it included, why he was doing it in the first place, and what the benefits were. So, because for guys who are doing it, they're typically doing it to improve performance and make sure that they are checking for anything that's lurking under the surface. And I have a sneaky suspicion that these days, with what we know, Wellman checks aren't really the most value for money for what's available out there based on what we know, really. So I'm going to do a little bit of a deep dive on it now. And I'm just going to take one at random because, and this is not picking on a particular company, but there are different types of Wellman check. There's the lower end, which is kind of like the £500, and then all the way up to about £2,000 plus, really. So I'm just going to compare, and I'll put it on screen and show you some of the things that I've seen when I look at these Wellman checks that are available. So the first thing is that all of them have no matter what tier, you have a 60-minute GP consultation. Now, firstly, I'm going to say that I'm not going to criticize any of this, because anybody who is taking a proactive approach to their health and they're trying to get healthier and they're trying to do something about it, I applaud it. And there are some things within this that are really good. But what I worry about is that sometimes it doesn't go deep enough to give people what they really want. And secondly, there is this almost like false sense of security that it can create when it hasn't really gone deep enough to show you exactly what it is that you want, or achieve or tick the box that it is that you're trying to tick. So first of all, they say, so all of them get a 1-hour appointment with a GP. Now that's great, but I also almost think straight away that isn't enough. Like when I think about the patients that I see for the first time and we're doing the orientation phase of our treatment for longevity to help them understand about their body, what's going on, I have 3 appointments with them within the first 4 weeks. And the first one is like 90 minutes plus, maybe 2 hours sometimes, to really get into the weeds. So I'm not sure that straight off the bat, one 1-hour appointment is going to be enough to really get into the depths of like exactly what their behaviors are, how they're eating, how they're sleeping, how they're exercising, all of that stuff to really give me the information I want. But let's go and look. So the next thing they talk about is the bloods. Now, it doesn't tell you the exact details, as you can see. It just kind of gives you general things. But I did a little bit of digging deeper and found that they'll do things. So they'll do a full blood count, kidney function test. Now, they don't do cystatin C. Cystatin C is a newer measure of kidney function and a better way to calculate what you call the glomerular filtration rate, which is the amount of blood and how much blood you're processing through the kidneys and how quickly they're doing that. There's a much better way to do that now, which they're not doing here. They are looking at the liver function, which is important. They're looking at gout, they're looking at uric acid for gout. But uric acid is really important as well for a marker of inflammation. But what I see that they're not doing here is the other markers of inflammation, which I'd like to see, which is homocysteine and highly specific CRP, which is again another very fine-tuned inflammatory marker, as it says, highly sensitive. So what we want to see is that it is really kind of zoomed in depth in people's levels of inflammation. There's a bone profile, anemia indicators. Now, one of the ones that concerns me here is both the cholesterol and the diabetes. So I saw that on the advanced one, they do Lp(a), which is kind of like a genetic marker for people who have really, let's call it really sticky cholesterol kind of, and it makes them more likely to get cholesterol in the arteries, that cause plaques and then cause a blockage to either the heart or the brain, cause a heart attack or a stroke. So it's really important to know that so that they can manage people more aggressively if that's raised. But what they don't do with the cholesterol is ApoB. ApoB is one of the newest, most important molecules that we've discovered to predict people's risk or directly correlates people's risk of developing a heart attack or a stroke. And it strikes me that they haven't talked about this and they haven't mentioned that they do this, because that is probably the most important metric that we follow from a heart health or lipidology, which is like the facts in your blood point of view. So, okay, let's move on. Diabetes screening, they do fasting glucose, I hope they do fasting insulin, and HbA1c. Now, again, this is where I feel like it's lacking, because what we do is an oral glucose tolerance test. And I think that's such an important thing, because when we go back to why we're doing a Wellman check, we are looking at this for, again, especially this is, I'm doing a Wellman check here that you can check out. But for men, we want to optimize our performance, and probably check for early signs of disease. Now, metabolic disease is one of the biggest accelerants. So like pre-diabetes or pre-diabetes, but high circulating insulin is one of the accelerants of all of the major diseases that come for us, like cancer, like dementia, and cardiovascular disease, which we talked about, right? So heart disease. So we want to understand early whether we've got very early signs of insulin resistance. And an oral glucose tolerance test is the gold standard, well, the best way that's accessible to the average person on the street who can go and do a clinician test. So that's really important, because what they do is that in an oral glucose tolerance test is they'll take your blood at fasting, then they'll give you a really sugary drink. Imagine like having almost a litre of that pure Lucozade original. Then they will measure your insulin and blood glucose at every 30 minutes for the next 3 periods, right? So 30, 60, and 90 minutes. And that's so important to see how your insulin levels, particularly at first, will respond to a glucose challenge, because that is like the 20 years prior to developing diabetes sign that you are on track to that. And intervening then is a lot easier as well, because it's so much more difficult to get it when you're further down the line. With all of these things, my concern, and I'll talk about later, my concern is that you are kind of it's set up to catch stuff way too late. We want to be 10 years ahead of this, 20 years ahead of this, so that we can nip these things in the bud. So then the next thing is they do some cancer screening ones. So they'll do your PSA for your prostate and QFIT for bowel cancer screening. Now, these are good. It's good. I mean, really important to measure these, but the QFIT sometimes can lead to false positives, because then it's checking for any blood in the stool. And just because you don't have blood in the stool at the time that you collected the sample, it doesn't necessarily mean that you don't have a cancer, right? It might just be that it wasn't bleeding at that time. So better ways to do this, but again, this is beyond the scope of a Wellman test. Is like a true check, which is they're basically a blood test for any DNA strands of cancer that are circulating in your blood, and that will kind of give a clue as to whether there's any type of cancer in the blood. So a much better one, but obviously a lot more expensive. So that's the blood tests, and again, like I say, pretty decent. Some things are missing. Well, I say pretty decent. A lot of important things are missing, because when we're thinking about things from a longevity point of view, we want to kind of address those big four that I talked about. And really, all of them are kind of ticked, but only half ticked, really. They're not ticked to the best of their ability. And again, sometimes it can lead to a false sense of security, thinking these are fine, and actually, you're, again, on the path towards one of these diseases. So then they go down to the examination. So they kind of sell this like full body head to toe examination, and they do a BMI, they do waist to hip ratio, they do a full cardiovascular assessment, respiratory assessment, GI. So they're just doing full examinations of the body, and they'll do lung function tests, which I imagine is a peak flow, something like that. In fact, let me have a look. Let me see if I can find exactly what the lung function test is. Yeah, so as expected, it's a peak flow, which is basically the thing they do to test for asthma patients to see if they can inhale and exhale oxygen at the level that they were supposed to do. So again, not really going to tell you much. From when we go back to the original goal of this, what is it going to tell you in comparison to actually what we're trying to do here? So that's basically it for the basic one. Now let's look at the other one, which is like £2,095. So they do further tests, which is actually the basic one doesn't do the lipoprotein A, the one that I talked about with the sticky cholesterol, if you want to call it that. So the more expensive one also does some deeper blood levels, some testosterone, sex hormone binding globulin, all of those other things, which I would kind of expect people to do as standard as a full blood panel anyway, because they're kind of checking different components here, and they're comparing 56 in the basic to 61. Yeah, I think you should just do all of them really as part of it. So what else is included beyond the bloods in this all singing, all dancing one? So really it's exactly the same. I didn't mention they throw in a prostate exam, which I'm sure you're glad to hear that you're going to get that. But yeah, they do ECG. Again, it's not really going to, a lot of these things are only going to tell you when there's a real problem, but we're trying to get ahead, we're trying to get 10 years, 20 years ahead of these problems. But these are things that will show up on investigation way after the problems started. It's kind of that locking the door after the horse has bolted sort of thing. So the one thing that they do in the all singing, all dance one is a CT coronary angiogram. So it's basically a CT scan of the arteries that supply the heart, which is the thing that we want to avoid getting blocked if we want to avoid a heart attack. So it's good that they do that. And, you're paying £2,000, you could probably pick one of those up for under £1,000. So that's probably where the extra money's going alongside these extra blood tests. But again, we're missing, I mean, that's a really good thing that they do that, but we're missing a lot of important things here. Firstly, where is the DEXA scan? That's the most important thing. Again, remember what we're trying to do here. We're trying to improve performance, and we are trying to look for hidden risk. Now, one of the most important things for our metabolic health is our visceral fat, and DEXA scan is the gold standard for understanding how much fat we have around our organs, how much muscle mass we have. It is one of the most important predictors of our longevity, how much muscle we have. So a DEXA, relative to some of the things that they're doing here, is quite cheap and really, really informative for our long-term health. Another thing, VO2 max, the amount of oxygen that you can use it's basically a measure of your cardiorespiratory fitness, is again probably the biggest predictor of someone's long-term health. Why in a Wellman check are we not doing these? So really important stuff. But also the last and final thing that I think this is lacking is, where is the follow-up? What they say is that you have a full medical report with advice and guidance is sent within 2 weeks. So basically, you see someone once, you do some bloods, and then on the fancy one, you do a scan on a separate day. And then that's it, you get a report and good luck to you. Now, that is missing so much stuff. Like, one of the most important things in my clinic when I'm seeing patients is behavior change, reading the data and starting to make changes, and more importantly, remeasuring. You need to understand whether it's all well and good being like, oh, this is kind of wrong, go away and do this, good luck to you. We need to firstly get some accountability, make sure that they are doing the changes that we're saying. But also, how do we know if this is going to work? We need to remeasure. And yes, you can do another one of these tests, but it kind of feels like a waste of money to go and have another exam a few months later. A lot of these blood tests, like the Lp(a), you only need to do once. Some of these things, they're not repeat tests that need to be done all the time, but some of them are. But it feels like to pay for the whole thing again just to get some of the repeat bits that you need, again, is a bit inefficient and a waste. So overall, look, I think I don't knock it. I think it's a great thing that people are doing to try and be proactive about their health, and it makes it accessible. But if you're spending £2,000, there is a much better way that you can do this. You can get a lot more information, a lot more valuable stuff. Something that has a long-term approach, is having behavior change built into it, has some follow-up, has some of the important things like DEXA and VO2 max. So overall, look, I think it's not a bad thing that people are looking to improve their health and being proactive about it. But the problem, like I say, is that it doesn't go deep enough for me. It doesn't look at the right things. Really, what the issue that I have with these Wellman checks is they're probably not updated in line with what we know about longevity now, and what we know moves the needle, and how detailed we can be, and how proactive we can be to dive in 20 years before we see a problem. Like I say, this whole thing is to improve people's performance and to look for any lurking problems underneath. So I want to know, like, where's the DEXA scan? Where's the oral glucose tolerance test? Why are they not measuring ApoB? Why are they not measuring VO2 max? These are like fundamental things now. So really, it probably doesn't go deep enough. It doesn't have the behavior change element of it, which is so important. And really, I think if you're spending over £2,000 and your goal is to seriously look for disease or seriously try and improve your performance, there are much better ways to do it. But if you want to understand some of the more important things to focus on, I recommend that you check out the channel, and this video here is going to show you some of the most important things to focus on to improve your long-term health. Thanks for watching, and I'll see you over in one of those videos.